until the age of 2 before deciding whether a child or a baby is part of the human family. And so because it has no self-awareness, a non-person has no right to life, because an actual person's well-being could be affected by this non-person. So if you devalue the fetus, the logical consequence is that you're going to devalue the newborn. And that's what they're arguing in this paper. And once again, it's using a good pro-choice argument to kind of trying to carry it out to its logical conclusions. Now, I'm presenting this topic today, and once again, I really appreciate this conversation, because this article in the Washington Post magazine, a young woman at the University of Maryland, is a first or second year student. I assume most of you here are first and second year med students. There are some PA students. It's called A Hard Choice. And I was very impressed with this young student. Just like, in a way, even though I consider myself pro-life, I hold in regard people who are ideologically pro-choice, who then are pro-abortion and actually go and do the procedures. Because she talks about this very, very interestingly. She says, and this is common to many of us, you know, I don't know until I'm faced with doing it, but I think I would absolutely be able to provide abortions, she said. I'm going to walk the walk instead of talk the talk. I want my actions to be consistent with my words. And I think a lot of us here would agree with her. And I think she's getting at what it means to have a conscience. There's a consequence of what we believe in. So she's at our papaya workshop, where a lot of first and second year students will go and kind of simulate the abortion procedure. And it says, a few days later, thinking over the papaya workshop, Leslie concluded that something was missing. Any discussion of how it might be difficult for doctors to perform an abortion. This was the way of medical school, the basic facts, not how to deal with a patient's or a doctor's own feelings. Why would this be any different? The doctor was probably just treating abortion like any other medical procedure, which he should, or she should, and to take away the stigma, the emotional charge associated with it. But you can't deny it, she says. I feel they're ignoring it. I wanted more guidance on the softer side of it, the emotional quagmire of what you have to deal with every day as an abortion provider. Right? This idea that it's hard to be an abortionist these days. It still is, even after 40 years. For many of the pro-life folks in the audience, I'm really here to show you that it's not easy to do abortions, no matter what the rhetoric is. So many times, the right and left, or the conservative, however you want to call it, life versus choice, life versus abortion, we want to beat each other over the head with commentary and trumping data. And yet, we don't have this conversational ability to kind of have this conversation where we're trying to understand the other. That's what I'm talking about, spirituality in medicine a lot of times. It's this doctor who's trying to listen to our patients. And so this idea that it's hard to have fear of anti-abortion violence, extreme rhetoric on all sides, the social stigma, and the marginalization of peers. This idea of the social stigma. Why, after 40 years, is there a stigma with abortion? Some people would say, well, that's political. Well, in medical school, it's not political. She goes on to say, the patient was in obvious pain, her screams made Leslie the chills, and she thought she might throw up. She saw the second procedure was easier. Are you sure, the doctor asked? She went and saw a second trimester termination of abortion. The procedure took not 5, but 10 minutes. The dilators were bigger, there was more tissue to remove. It was definitely gruesome. You could make out what a fetus could look like, feet, lungs, but it didn't look like a person. She herself expected to be very upset. She felt that way at her first autopsy, but this was different. She didn't regard the fetus as a person yet, and she said she was happy to help the woman. I feel like I was giving her a new lease on life. It's this challenge. It's this difficulty. Leslie describes a process that she found disturbingly brutal. A papaya doesn't bleed and scream, she says. Women do. So she didn't want to have to steel herself emotionally to perform abortions, and she was coming to realize that that's what she'd have to do. I find this article to be very, very insightful on both sides of the issue. So for the pro-life side, understand the challenges of what it means to be an abortionist. On the pro-choice, pro-abortion side, you have to come to grips with the humanity of the fetus. Does a 6-week abortion equal a 22-week termination? That's a question that I think you have to ask. Because for myself, I found this to be so similar to my own experience. I went into medical school because I was politically pro-choice. A woman has a right to her body for any reason at any time throughout her pregnancy. I don't think I could have gone as far as infanticide or after-birth abortion. But man, that's where my heart was. That's where my mind was. And doing the procedure, the actual transmission through the instrument to your hand to who you are as a person, is a difficult thing to do.